Move on to our next speaker, which is Elisha. So Elisha, I'm going to throw the ball to you, so it's up to you to catch it. Are you ready? 1, 2, 3, go.
Thanks very much, Marion. That was really interesting stuff from Dr. Hardin. My name's Elisha Fisher. I work for the Scottish Government. I'm Senior Policy Officer for Community Learning Development Policy, which includes youth work, adult learning, ESOL learning, and a whole range of community-based activity. So, a bit of background to the CLD guidance. The CLD guidance was developed and continues to be updated and refreshed in collaboration with partners and stakeholders from right across the CLD sector. In order to publish the guidance, it went through a really rigorous process. So after we gathered all the feedback from stakeholders in COSLA and trade unions, Health and Safety Executive, Health Protection Scotland, and legal colleagues, we then forward that to ministers to say, are you happy with this? Is there anything you would like us to add? And then we go ahead and we publish the guidance. So what is the point of the guidance? Why did we do that? It was a lot of work at the time and continues to be a lot of work. Purpose of the guidance, really, in very short and succinctly, is to help you, is to empower you, the service providers, the practitioners, to make really important decisions in your own local context. So I suppose following on from what Dr. Hardin was saying, a 4 harms assessment determined that CLD activity can take place for the purposes of work, education, training, and the avoidance of harm. So the primary objective in producing the guidance is to reduce the transmission within communities when all of that work takes place and where it is important work. So the guidance isn't about the value of CLD on learners. I think everybody already knows the impact that CLD makes. It's really important that we have that sort of context in there to help other service providers to understand the value and the impact that CLD services is having on maybe some of Scotland's most vulnerable people. It's also really important that the guidance is set out in a way that lets everyone involved in CLD know what their responsibilities are in relation to keeping everybody safe. That includes staff, volunteers, learners, keeping everybody as safe as possible in the services that they're trying to provide. So how would we use this guidance? The guidance should always be used alongside other relevant guidance, and that would include guidance such as unregulated children's services guidance, existing guidance for colleges, schools, local authorities, and very soon there'll be guidance published for community centres reopening. I think that's maybe another sort of couple of weeks away, but I have seen a draft of that in recent days. As well as this, every part of the CLD sector has its own guidance. So if you think that YouthLink Scotland has guidance for youth work services, SCDC has guidance for community development, and currently in train is guidance for adult learning too. So every sector will have those sort of practical elements where the Scottish Government guidance is a broad overview and more health and safety focused on keeping everyone safe. The practice elements will be embedded within that sort of context for the sectors. The guidance should be used in conjunction with the coronavirus regulations, the Scottish Government's route map, and the new strategic framework, because there's a lot more information within that. That'll help. So if all of this information is used together, there is no one single one-size-fits-all, especially where CLD is concerned, because it covers so much in terms of what we do. So what would be the key messages that I would give you? The guidance is designed to help everybody to think about the services that they're providing. So what services are you providing, and what are the impact of these services on service users and on the wider community? I would say that first and foremost, a very cautious approach is always required in relation to the virus, no matter what service you're operating in relation to CLD. For example, just because you can start a service doesn't mean you should start a service. The guidance isn't a replacement for the decisions that have to be taken at a local level in the best interests of communities and learners. So I suppose an overview of that would be that the guidance is about helping you to consider the learning environment and the mitigations that can realistically be put in place, but being honest with yourself and other people about how the spread of the virus and the mitigation in place affects the services and the service users, and understanding whether the behaviour of service users will affect the mitigation that's been put in place. For example, will learners or activities have an impact on other service users within the premises? Will learners be able to understand the rules that are being put in place and the mitigations? And are they likely to adhere to those? And that's just 3 considerations. I'm sure there's many, many more depending on the context of the group that you're working with. So we would ask everyone to adequately assess the risks to everybody involved. It's about knowing your service and the working environment and assessing the impact of the work and the importance of the activity, while recognising the social needs for young people and access to the likes of youth work services. The guidance has been developed with stakeholders and measured to strike a balance between this and the household restrictions in order to avoid the harm presented to young people and their families through transmission of Covid-19. And it's the same for many things over CLD. I'm just using youth work as an example, primarily because I run a youth group, and although it's very, very good to see the young people together, but that comes with a number of risks. And the young people have actually told me that they don't want to restart because one of them is extremely vulnerable and had a transplant. So we wouldn't want to put that person at risk, and the young people decided that for themselves. The most important message, I think, oops, something's kind of happened to my screen.
Elisha, I'm going to have to ask you to finish up anyway. I'm just conscious of the time. So
Yeah,
if you could get last final words just so we can move on. But I am conscious that Mark Meekins just asked in the chat if you could clarify, is there guidance for the reopening and safe use of community centres coming out in a couple of weeks? So
yes.
if you can just quickly answer that for Mark, and then we can move on, that would be great. Thanks.
Okay, the final word would be, if you're not sure what you're doing, stop, connect with your public health, your local public health and environmental services, and seek advice if you're not sure what you're doing. And in answer to Mark's question, very, very short and very quickly, yes.
Good, well done. I like that. I like when there's a nice, happy, rounded ending there.